The One Big Beautiful Bill in Washington is bringing together advocates in West Michigan to discuss proposed changes to Medicaid. I spoke with Michiganders who say the plans in Congress will impact their lives.
I've had probably around 500 fractures throughout my life. I've had a couple of hundred surgeries to repair the fractures. And I've been living with life of physical pain.
Scott Becker was born with a brittle bone condition called osteogenesis imperfecta, which does not allow him to work. His condition requires him to take a handful of medications every day. He says without Medicaid,
I'll end up getting sick, possibly having to rely on family and friends for, financial support to pay for medications, possibly even having to move in to a home or something.
He not only voices concerns for himself, but for others as well.
I got family that's dealing with cancer. I got friends that are dealing with cancer. No one person is immune from, illness. I mean, you could walk across the street, get hit by a car.
Becker is one of many who attended Disability Advocates on Thursday to educate, an event where voices were heard.
We've been reaching out to our Congress people, both sides of the aisle, as we always have. We want to work on reform. This bill right now does not look like reform.
States like Michigan may have to carry the weight of the costs of operating programs like Medicaid due to the federal cuts proposed in the bill, which would also add more requirements for people to qualify for Medicaid.
Most folks on Medicaid who can work already do work. That's the Medicaid expansion.
The Michigan Department of Health and Human Services says the federal cuts in the bill estimate that approximately 30% of Medicaid beneficiaries in the state would lose health care coverage as a result of the $1.1 billion annual loss of Michigan's budget.
And then to go to the doctor, it's like, oh, I'm sorry, you can't, we can't see you today because your Medicaid's no longer active. And then what do? You miss a diagnosis.
Jenny Knight tells me her working daughter suffers from mental disorders.
The medication she needs for her schizophrenia is Invega Sustenna, and it's an injection. That injection costs somewhere between $3,000 and $6,000 every time she gets it.
Knight adds the private insurance does not cover the costs that Medicaid does.
She is so afraid of losing that Medicaid because she knows that's what's keeping her alive.
Jenny and her daughter may be left with no choice.
So we're actually looking at, is there other options for us to leave the country and get her medical care somewhere else that would cover it.
In Grand Rapids, Cassandra Alonso, Fox 17 News.